Yeah, and as you guys mentioned, right now a CDC panel is meeting and seems poised to recommend COVID-19 booster shots, paving the way for millions of Americans to once again roll up their sleeves. Today I talked with the Commissioner of the State Department of Public Health, who told me Connecticut is ready.
Very quickly.
1 month on the job, and Connecticut's newly minted state health commissioner is jumping headfirst into the logistical rollout of COVID vaccine booster shots.
We have plenty of vaccine.
So, will you get a booster?
I am planning on getting a booster. I think that the research presented thus far supports that.
And would you mix and match the brands?
I would say I would be open depending on what would be the most recommended, but I would like to see some data from the scientific community.
A limited study by the National Institute of Health showed mixing and matching likely gives broader protection, especially for those who originally got the Johnson & Johnson vaccine, to be boosted with an mRNA, Moderna, or Pfizer dose. The FDA analyzed that data and approved the idea. The CDC seems poised to do the same.
I think it'll streamline the ease with which people can get boosters.
Connecticut has 416 vaccine locations. Most of them don't require any appointment. But unlike first doses, you won't see the big mass vaccine sites. Keeping all the info straight for you is the Connecticut United Way 211 call center.
So the service we're providing to the residents of Connecticut is to help them to find the location nearest them that offers the vaccine at a time and under the circumstances most conducive to them being able to get it.
And while booster shots for Moderna and J&J are on the way, the state has already administered more than 110,000 Pfizer booster shots for those 65 and up. We asked Commissioner Giuffani if she's worried that a focus on booster shots will make it even harder to reach the thousands of Connecticut residents who still haven't gotten a first dose.
Our outreach efforts still show that there are people who are still considering vaccines. They just need a little bit more time, a little bit more information, and state mandates and other private sector mandates are coming into effect as well.
Ranking second in the nation, 70% of Connecticut residents are fully vaccinated, minus those aged 12 and under who are not yet eligible, and that number jumps to 80%. And it's not just vaccines. We've also been hearing a lot about a COVID pill, which is meant to be taken orally after you show symptoms. It's meant to prevent severe disease. I asked the commissioner if Connecticut is trying to procure a supply of it. She said it is, but that supply will be very limited at first. We're live outside the Department of Public Health in Hartford. Matt Caron, Fox 61 News.